further ado, please welcome Mr. Delroy Richards and Mr. Shelbourne Webb. Welcome, welcome, welcome to our program tonight. Welcome, Mr. Webb. Welcome, Mr. Richards.
Okay, thank you.
Yes.
Thank you.
Yes, so they'll be sharing some bits about motherhood and first aid. So, welcome again. Take it away, Mr. Webb. We are anticipating your presentation. Go ahead.
Okay, I am Delroy Richards, as been introduced before. Hello, everyone. It's good to be here. Right, with me, as introduced before, Mr. Selburn Webb. And what we will share today is all about first aid, its importance, etc. We're going to touch on cardiovascular emergency as it relates to first aid. We will show a video on a CPR, two videos actually, and then we'll entertain questions. Now over to you, Mr. Webb.
All right. I'm tempted to say good morning because it is morning in my neck of the woods, but I know that persons are here from different time zones. So whatever time it is to you, I just want to greet you, welcome you. And as we share with you briefly, let me hope that you will benefit from this presentation. Just confirm for me that you are actually seeing my screen.
Yes, we can.
Yes.
Thank you.
All right. All right, so we're here sharing with the program, and we understand that the emphasis basically is on motherhood, and I'm certain that first aid fits right in this. Am I right? Yes. Mothers right across the world, they play the role of doctor, nurse, physiotherapist, dentist, and everything. So it's good for you to have a good idea of what first aid is and how it will assist you in your role. And for those of us who are here who are not mothers, I know that you'll also benefit. So when we talk about first aid, what really is first aid? First aid is really this initial or basic assistance or treatment given to somebody before they can reach advanced care procedures or before they can get what we call medical help. So it's always important. Mothers, you are at home and you are with your children, you are with maybe a spouse, something happens right there and then. It is always very important for you to know what to do right now. Because if you don't know what to do and you just wait on EMS, or if you are living in Jamaica where EMS is sometimes non-existent or far away, then you know that you can be in big problem. So the aim of first aid is really captured under what we love to call 3 P's, all right? And the first P is to preserve life. The second one, to preserve illness or injuries from becoming worse. And the third one, promoting recovery. So basically what you're trying to do in first aid is really save a life, first and foremost, prevent the illness or the injury from becoming worse, and promoting recovery. This is what you want to really happen. However, once you're doing any sort of first aid, there are some basic precautions, we call them universal precautions, that you always follow these steps. And they are very simple, right? You wash your hands, you wear gloves. If you have to handle any sharp objects such as blades or needles, handle them with care. And even though you're in a setting which is a family setting, it is always good to practice that. If you have to breathe for anybody, you use some sort of barrier device, whether a face mask, a pocket mask, or a face shield. All right? And whenever there's an emergency, I know that sometimes, especially the motherly instinct will chip in, and you will want to just run and just act. But you have to always consider to stop and think about safety. Stop and think about safety. So we look at what is called a scene survey first. So you're probably, maybe you're in the kitchen, probably you're in a bedroom, it's outside, whatever it is that is happening. Even though your loved one, more than likely a child, maybe a spouse, a sibling is injured, do not just rush to help. Stop, check around, ensure that the area is safe. And then you do what is called a primary survey. A primary survey is trying to quickly identify if there are any life-threatening injuries. Usually these injuries would come under ABC, airway, breathing, or circulation. And once there are any such conditions, they will be treated first. From then you move on to what we call a secondary survey, when you would look for other injuries which are not necessarily life-threatening. So this is where probably your broken bones, etc. would come in. Thereafter, you think about the ongoing casualty care, where you would continue to take care of the injured person now until medical help arrives. Or in our case here in Jamaica, Jennifer, if we know that the medical care will not come to us, we'll do the ongoing care whilst we are transporting the person to the medical facility. All right, Mr. Richards will pick up here and just tell you a little bit about how to control external bleeding.
Okay. In terms of bleeding, what we have to have in mind first is not to dress the cutter, clean the cutter, whatever. What we should have in mind first is to stop bleeding. That's important. Stop bleeding. And we stop bleeding by direct pressure and rest. Okay, so we have that.
Yes, thank you. All right, choking.
Yes, no, in terms of choking, right? When a person is choking, what we should do first, right? And this is relates to children and adults, right? Not infant. Infant is we deem infant to be from 0 to 1, right? So for adult and children, we ask them a question: Are you choking? We want to establish if it is partially blocked or the throat is fully blocked. If it is partially blocked, we'll encourage them to cough. However, if it is fully blocked, we'd have to give them 5 back blows to the back between the shoulder blade. If that doesn't work, then we give them 5 abdominal thrusts, right? For the infant, we'd have to take up the infant. And we can't ask the infant, are you choking? If that infant answers us, something wrong, right? We have to put the infant in a position where we give the infant 5 back blows, right? Followed by 2 fingers on the chest, as if we're doing CPR, and 5 chest thrusts. And occasionally we check if we can see anything in the infant mouth. If we cannot see anything, we don't search for it. But if we see anything, we can take it out. That is just a synopsis pertaining to choking.
Thank you, Mr. Richards. And the choking one is very, very, very crucial because you're at home and if first aid is not done for choking, you cannot just sit around and wait for the EMS to arrive because that might just be too late. All right, you can pick up on the poison, Mr. Richards.
Yes. First of all, prevention is the best thing for poison, right? We must put away things accordingly, right? We store any household chemicals, right? Not on any height, but locked away, right? In a cupboard, right? Make sure that the children especially don't have access to it. And when we are cleaning our bathroom, etc., we must not mix chemical, and we must make sure that the place is highly ventilated before we start cleaning, right? If someone should swallow poison, first of all, you call the poison control center. We don't have one in this country, right? What we'll do instead, we'll call an hospital, right? We get the victim, right, or the casualty as soon as possible to the hospital. And it is good if you can bring the container which you suspect that a casualty used to poison is or herself. Yes, Mr. Webb.
All
Yes.
right. So yes, go ahead, Richard.
Go ahead, sir. Okay, go ahead. Okay. Heat burns, right? And this has to deal with burns in general, right? Immerse in cool water, right? Remove your jewelry because that area might begin to swell, and if it began to swell, it really is going to be difficult to remove it then and there, and it can cause other problems. Loosen tight clothing before swelling occurs, as it says, right? Immerse, if it is possible, in pure cool water. Cover the burn area totally, right? Apply clean cloth soaked in cold water if you don't have any water unto use, right? It is important that burn that will deal with burn. We don't use anything else on burn. We don't use any Vaseline as well. We have it. We don't use any milk. We don't use any ointment. We don't. Some people use toothpaste. We cannot use those things. And some people use butter. We cannot use those things. Those things will trap in the heat and the cause the injury to become more and more. Right.
All right. Thank you so much. And I just yes.
Go ahead, Mr. Webb, with the chemical burns.
Right. So sometimes around the house you might have some sort of chemicals that can spill and cause a problem. So for chemical burns, the first thing that you would do, as the slide here is saying, is that you would immediately flush the air with a large amount of water. All right. And this is very important for you to even continue the flushing, right, for at least 15 to 20 minutes. However, if what you have, I see the hand just a minute, if what you have is a dry powder that causes it, you would ensure that before you flush it, you would brush it off. Yes, Jennifer, I see the hand. Go ahead.
Yes, Mr. Webb, thank you so much. There is a question in the chat. Can you see it?
All right. You can read it for me.
Yes, someone is asking, how about giving them fresh milk on your way to the hospital after they swallow poison?
All right. So let me take that one.
Yes, take that one.
The reason why we said to call the poison control center is that for poison, it is not a one cap fit all, right? Milk can help in some cases because if it is something that is, let us say, acidic, the milk can help to neutralize it. Sometimes you can give them something like charcoal that will trap the thing and prevent it from being circulated in the body. But what happens is that it is always best to get instruction from the poison control center because they would give you specific instruction with regards to the specific poison. Sometimes there are some household chemicals that will have instructions on it to tell you what you can do as first aid. So you can always follow that, but we just want it to be absolutely clear that it is not a one cap fit all. So you'll probably use milk in a particular case, but do not accept that as being a universal treatment for all poisons. And what you should not do is that you should not induce vomiting. When we were growing up in Jamaica, we were told that if you are poisoned, they should try to do something to induce vomiting, but that is not good. So I hope that answers the question.
Loretta, did it answer your question? If we have any other questions, please feel free to type them in the chat at this time. Mr. Richards and Mr. Webb will be addressing your questions in the Q&A section. In the meantime, continue to use your reactions icon. Let them know that you're listening and that you're enjoying their presentation at this time. Thank you. Continue, please.
All right. So around the home, if you have children, especially males, they will run up and down, even in this era, which is very digital, but children will still run up and down and children will get hurt. So I will invite Mr. Richards again to just quickly give you a little update on fractures, you know, what to expect and what you can do.
Okay, fractures is simply broken bones, right? A fracture means broken is fracture, right? And how do we treat a fracture? Sometimes we don't know if it's actually broken, right? Because we have two types of fracture. We have closed fracture and we have open fracture. Now let us examine the signs and symptoms. All right, let me explain the closed fracture. No, closed fracture is that the bone breaks, right? But the skin is still intact. So you don't see any open wound, right? However, if it is open, you will see an open wound. The skin will be also broken. Now, signs and symptoms of fracture. The signs and symptoms are clear, right? Pain and swelling, discoloration, deformity, name it, right? And you have to look out for signs and symptoms of shock too, right? For the severity of a, of a, of a, of, of fracture. No, let me zero in on a particular fracture which some people pay less attention to, right? The femur fracture is very important, right? Because you can when the when all right, let me explain. The femoral artery, right, is the one which will run on the inside of both legs, near to the femur bone. Now the femur bone is the long bone in the thigh, right? When when that bone breaks, sometimes it can sever the femoral artery. And when it does, you can bleed unto death in no time. So whenever time anyone break their femur, right, they should pay keen attention to it, right? Just assume that the femoral artery might be compromised, meaning that it might cut, right? It might sever, and rush them to the nearest hospital as quickly as possible. Yes, move on. So you might be wondering then, how do we treat a fracture, right? We stabilize fracture using a piece of board, anything which is hard, and we call them a splint, right? If you don't have a board, anything rigid, because a splint should be rigid, it should be long enough, and long enough to prevent the joints above and below the fracture site from moving, right? So, for example, if you have a broken femur, which is the long bone in the thigh, right, you would have to have a piece of board from the ankle, and that board will go straight on the arm to prevent all joints above and below the fracture site from moving, right? We splint to prevent further tissue damage and to reduce pain. However, if you don't have a board, a line around or something rigid, a line around, we can do what it is called an atomical splint, right? Meaning that body splint. So, for example, right, as you see in the picture there, what we'll do, we'll use the on the body to help to secure the on the limb, right? If you have a broken finger, we use one of the finger as a support, and we bind them on together. This is what we call anatomical splinting. Yes.
All right. So as we touch down now, we're just going to quickly discuss some medical conditions that you might come across in the home. I know that as mothers, sometimes we have some non-traditional way to deal with things. And sometimes when we tell you the scientific way, we rebel against it. But we're just going to share some best practice and how is it that you can identify and deal with some of the basic medical conditions that more than likely you would encounter. All right. So the first one we're going to look at is as it relates to cardiovascular emergency. So we're going to look a little bit at heart attack and stroke. Mr. Richards will talk about that, and I will talk to you about seizures and fainting. So go ahead, Mr. Richards.
Okay. In terms of heart attack, first of all, how do you know that you're having an heart attack? Signs and symptoms of having an heart attack. Signs is what you are seeing. Symptoms is what the casualty is relating to you, right? So now the signs, right, is basically signs and symptoms of shock. You will see the paleness of the skin, and the person breathing rapidly, right? And the person clutching his or her chest, etc. But the symptoms now is that that person will tell you that they feel a crushing a chest pain. In other words, they feel like an elephant sitting in their chest, squashing them out. And they have pain from the jaw, come straight down to both arms or one arm, right? And they would have shortness of breath and the feeling of doom. They feel like that they are going to die, right? In that case, what should we do is to put them to rest, right? Because if they rest, it can very well be angina. Angina is just a mild form of heart attack, just to speak loosely on that, right? It is telling you that if you continue on the same, with the same lifestyle, when the symptoms comes again, it won't stop by resting or on medication. It will go straight to a cardiac arrest. So first, you put them to sit, right? Talk with a casualty, right? Ask them if they feel better sitting, right? Bend their knees, put a pillow on it, the knees, right? Still converse with them, right? And note that you have to take them to the hospital as soon as possible. In terms of stroke, no, and stroke has to deal with the brain, right? There can be a clot in the brain, right? And the blood vessel of the brain can a rupture cause a stroke. Now, how do you identify a person having a stroke? We use a simple acronym. We call it FAST, right? FAST, FAST. First of all, we look for the F stand for face. So we look for in a face drilling. If they are drill on one side of the face, or you ask them to smile and it's just half of their face smiling, that's a sign, right? A stands for arm drift. If you command them to hold up both arms and it's only one coming up, suspect a stroke, right? Um, if a S no, S is for speech. If their speech is slurred or they cannot talk at all, and the T means time. What time does these occur, right? And that is important, right? Studies show that if a person who's having a stroke get medical care within 3 hours, chances are it can be reversed, right? So when you see these signs, don't delay. Move them to the hospital as quick as possible. The earlier, it is the better chance of recovery. Go ahead, Webb.
Thank you so much. And I'm just going to pick up now as it relates to seizures. We call it fits. Other persons call it maybe different stuff. But you'll find that you might have a child at home and the child might start seizing. I'll throw the question to get some participation. Two persons, tell me now, what is it that you should do or maybe should not do if a person is having a seizure? All right,
Go
talk to me
ahead.
now.
Well, I know that you shouldn't try to hold their head down or put a shoe over their nose. Because sometimes we traditionally we have been taught to do that, put a shoe over their nose. That's what I think you shouldn't do in this kind of circumstance.
All right, and that is so true. There are many misconceptions about seizures, right? There are some persons who have a medical condition that they even have their own medication that they take, and sometimes it will prevent the seizures from coming on. But the seizures, it really have to do with the brain and the messages going to and from, and it's like a short circuit. So the main thing for you as a first aider to know is that you should not do anything at all to try to restrain the person, right? This is a myth. So do not hold down the person, do not tie down the person. And as was mentioned by Jennifer, please do not put anything over the casualty's mouth and nose. Don't find any dirty shoes putting over their nose or putting anything in their mouth. I don't know what to do in your neck of the woods. In Jamaica, it is a custom, especially in the country areas, when persons are having seizures and fits, they put spoon in their mouth, they put different items in their mouth, and all kind of things, right? This is non-productive and it is very dangerous. What you should do is just to ensure that the person surrounding is clear when they're having the uncontrollable what we call them now, uncontrollable muscular twitches. What you should do is allow them to have it, but ensure that the environment is safe. You don't want them to fall off a chair or a bed and hurt themselves. So you get them down on the floor, you can pad up the area around. Allow the seizure. The seizure usually will take about 2 to 3 minutes. If the seizure is continuing for 5 minutes or more, that's a red flag. That's not a good sign. Or if the person is having multiple seizures, right? But as soon as the seizure is over, you can put the person in the recovery position. And this is something that we're going to show you, right? Because it's a very important first aid. So remember for the seizures now, do not hold on the person, do not tie the person down, do not put anything over their mouth, in their mouth, or anything at all like that. Sometimes you'll find that for children, infants, right, they will have what we call febrile seizure. So they are not diagnosed with what's the name of the condition again?
Febrile seizure. They're not diagnosed with epilepsy.
Right, they're not diagnosed with epilepsy, but children brain cells cannot tolerate very high temperatures, right? So you will find that if a child have a high fever, running 102, 103, and by the way, mothers, if you have young children, you must have a thermometer. Right, very important. If the fever gone over 102, 103, you just place a hand here, you can feel it, right? That can cause the child to have a seizure. In that case, what you want to do is to find a way to help reduce that fever. Because as long as that temperature is up there, they will be seizing. All right. Sometimes even mothers go to the hospital to have a baby. And if your blood pressure is elevated, you can have a seizure. So it's not everybody with a seizure is having a issue that they need medical treatment to say they are taking tablets, especially for epilepsy. All right. Fainting is a very common and popular issue. A person faints when there's a disruption in the blood flow to the brain. It is reduced, right? Usually the first aid for fainting is to get the person down quickly and to elevate the lower extremities. If the person is wearing any restricting or tight clothing, you try your best to really loosen this so circulation can continue. All right, so we are touching down. I want to leave time for the question and answer. We have 2 short videos. I'm going to quickly show them now. And then if there are any questions, Jennifer, you can just entertain them for us and we will do the best that we can. All right, so let me go ahead now and just quickly go on to this video.
Our heart is an amazing organ. It works hard for us every second of every day, delivering blood and oxygen to every cell in our body.
Yes, okay.
But when sudden cardiac arrest strikes, our heart suddenly and unexpectedly stops beating effectively and blood flow stops. Without any
Yes, it frees a while. Continue.
The brain, vital organs, and our heart will begin to die. Beginning CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and after 10 minutes, brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes 2 critical things. 1, compressions move oxygenated blood to the brain to keep the brain alive. And 2, compressions keep blood and oxygen moving to the heart muscle itself, so that it has the best chance of resuming a normal electrical rhythm after a shock is delivered. As you begin compressions, you are creating an artificial pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we do not push fast enough. Watch what happens when we push too fast. The heart does not have time to refill with blood, therefore not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill with blood, therefore no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. So remember, you are their only hope. Do the best you can, and don't give up until medical help arrives or an AED is present. You can do it.
All right, so that was just a little introduction as it relates to CPR. CPR is one of the skills that we that we teach. Mr. Richards right now is on site at a particular location. In a few minutes, he'll be going into a class, and I can tell you that most of what he'll be doing today, he'll be covering CPR and the use of the AED. So I'm going to encourage those of you, wherever in the world you are, ensure that you are CPR trained, you know how to use the defibrillator. If you are in Jamaica, of course, you come to us at EFAS and we will deliver that training. But it is very, very, very important in saving a life, whether at home, at work, or elsewhere. Yes, Jennifer, go ahead.
Could you please put your information in the chat or your card so that persons will be able to access and contact you for this kind of training? Okay.
All right, will do.
Mm-hmm.
This video now, this will show you how to put a person in the recovery position. I want you to look at this one, and I'm going to give them an assignment. Jennifer, they can go home and practice this. Don't go home and practice the first video though, right? But this one, the recovery position, it is very important. If somebody is unresponsive, they are unresponsive, but they are breathing. So follow me now, they are unresponsive, but they are breathing. You do not leave them lying on the back while they are waiting on medical help. You'll put them in a recovery position. So go ahead and look at this video now.
If they're unconscious or unresponsive, but breathing normally, put them on their side in the recovery position. This helps them to continue breathing normally by keeping their airway open and clear. For example, it stops the most common airway obstruction, their tongue, from falling back and blocking the movement of air. It also means that any vomit or fluid which comes back up can come out, rather than causing them to choke, which could happen if they're on their back.
To put your casualty into the recovery position, this is what to do. Kneel beside the casualty and get yourself in a comfortable position. Check the casualty's pockets and remove any bulky items. Remove any sharp rings, and if they're wearing glasses, take them off. Make sure that both the casualty's legs are straight. Place their arm nearest to you out at a right angle to their body, with the elbow bent and the palm facing upwards. Their arm can be placed straight out to the side if it can't be placed at a right angle. Take their other arm and place it across their chest, and hold the back of their hand against their cheek nearest you. With your other hand, lift their far leg just above the knee. Pull it up until their foot is flat on the floor. Now you're ready to roll them onto their side. Keeping the casualty's hand pressed against their cheek, carefully pull on their bent knee to roll the casualty toward you onto their side. Now their top arm should be supporting their head, and their bent leg should be on the floor to stop them from rolling over. Their top leg should be at a right angle to their body. Remove your hand from under theirs. Check the casualty's head is tilted back. This will keep their airway open and clear.
Once the casualty is in the recovery position, you should call for medical assistance if this hasn't already been done. Remember to recheck the casualty's breathing at regular intervals until medical help arrives. If it stops, you'll need to give them CPR. If the casualty has to be kept in the recovery position for more than 30 minutes, turn them onto their opposite side to relieve the pressure on their lower arm, unless their injuries prevent this.
All right. Thank you so much for your attention. And we are now going to open for a few minutes if there are any pressing questions we would really like to deal with them. So we're going to open the floor now for your questions.
Mr. Webb, I saw several questions now. I saw
The
several
chat,
questions in the chat.
yes.
Yes.
I'm gonna read them
So
for
I put them
you.
forward for me.
Right. Jennifer will
Yes.
read them for us and we'll address them.
Yes.
Okay, so Mr. Denton Smith asks, is there any merit to using BC to counteract poison or as an antivenom when you're stung by a scorpion?
All right. Do you want me to answer that, Mr. Webb? All right.
All right. I'll take that one, Mr. Richard. So,
all right, tell her yes.
I will not say there is no merit. Those of us who grew up in Jamaica, we could attest and we can attest to the fact that it is used and it helps. But I still want to keep the point open to you that
Yes.
it is not a one cap that fits all. Right? Mr. Richards, anything?
Yes. In terms of scorpion bite, what we do, especially in Jamaica, we use any antihistamine medication, right? Like your DPH, Elixir, Benadryl, name it. Anything which mark antihistamine, right? And that is what we use successfully in combating bee sting, scorpion sting, etc. Right? And if you have an EpiPen, that is acceptable too. EpiPen can be used. Yes, Webb.
Okay, another
I think
question. Princess Smith asks, can rib fracture heal without medical intervention?
Yes,
Yes.
usually for the ribs, right? This is not an area like the upper or the lower arm where you are going to put in a cast, right? But what happens is that with rib fracture, in the early part of the treatment, it is crucial for you to identify it, right, by the tenderness and so on. And from a first aid standpoint, if you're at home, you can use a pillow or a cushion or something if you are transporting a person to medical help to prevent any further injury, because we have a condition that we call flail chest, where we have 2 or 3 or more ribs adjacent to each other. If that happens and the rib cage becomes weak, you can have problem, and the ribs, as you know, can go and cause internal damage. So the initial treatment of it, from a first aid perspective, it would be to pad up the area to prevent any further underlying damage. And then once that is done and you get medical treatment, then the whole therapy and stuff, it can heal on its own, but you still need to get medical attention.
Medical, yes. Cool.
She also asks, and I think this is relating to epilepsy, shouldn't we put something in their mouth to prevent them from biting their tongue?
No. Capital N, capital O. If the person wants to bite their tongue, let them bite them tongue. What's the problem? No issue, no emergency. All of us sometimes when we are talk and eat, bite a tongue. You won't die, no harm in it. The harm is that when you're trying to put something in the mouth, you're going to interfere with what we call ABC. You're going to interfere with airway, breathing, circulation. And then this person who is having the seizure, whilst you're having the seizure, during that period of having the seizure, they are unresponsive. They don't know what is happening. They are unconscious for a brief moment. And for the unresponsive person, the worst thing you can do is to put something in their mouth. Persons die, even in hospitals, somebody feeding them, and they can't control the tongue, the airway. So putting something in the mouth or across the mouth to prevent them from biting their tongue, it is something that we should stay away from.
One more question. It says, how do we maintain a healthy heart? Mr. Smith was asking that question.
Okay, well, I will take a piece of this, right? Now, to maintain an healthy heart, right? One answer after the bat, exercise. Exercise. And eat food which has low cholesterol levels, right? But exercise is the biggest thing in this one, right? If you don't exercise, right? We're not talking about losing weight now, but exercise, right? And the art to respect exercise, right? Web, anything else on that one?
Yes, there are some factors that are outside of your control. So
Yes.
age and so on, you can't have anything. And the older you get, the blood vessels naturally will become a little narrower, which will
Yeah.
push you more towards that. But as Richards stated, exercise, eat right, avoid stuff like smoking, avoid excess drinking, and a good healthy diet. So a general healthy lifestyle is best, and try as best as possible to maintain your optimum weight, because obesity affects every medical condition. So those are just some off the bat tips.
So, Mr. Webb, how can we get in touch with you? How can we start your program? This sounds really interesting. Loretta said she has learned a lot. Great presentation. We want to know, how long is the program? How long is the training program? And how can we access this program?
All right. So if you are in Jamaica, and why I started by saying if you are in Jamaica, whilst we can do first aid and discuss like what we're doing now, I sure that we can appreciate that first aid is a skill. So the hands-on part is extremely important. So we operate, our main base is in Jamaica. We do on-site training in Jamaica. We go across the 14 parishes on the island, and the training that we offer, right? The training lasts for 1 day. It's 7 contact hours, right? So, for example, this morning, Mr. Richards is in Kingston. He'll be on a site from 8:30 until probably 4:30. It's a high, it's not a very hard course. It's not very, we don't teach by giving you a lot of stuff to go and study and to remember and to pass exam, right? We have explanations, demonstrations, and you get a lot of hands-on. So you get to do practicing lifting and handling, CPR, choking, how to deal with burns, and persons, we talk about fracture, you'll actually get the chance to do the bandages and the splinting and all these things. And once you do the training and the assessment and you are certified, the certification that you will receive, it's internationally recognized because we're a part of ILCOR, and we are policed in Jamaica by the National Resuscitation Council, who will be the watchdog for ILCOR. So that is the reason why when we give you a certificate here, you can bring the certificate to the United States, Canada, Japan, China, wherever it is, until the 2 years. The certificate only lasts for 2 years, and this is an international requirement for first aid certification. After 2 years, you are required to go back in the classroom and to be refreshed on the skills, and sometimes some things might change. For example, during COVID-19, the way how we practice CPR would have changed. We are pushing now to what we call compression only, as opposed to compression and breaths. So basically, that's it in a nutshell. I don't know if I left off anything, Mr. Richards, you want to touch briefly?
No.
I can attest, I have a testimony. I was trained by Ms. Richards, and it was very thorough, and I had a great experience. I still have my card. Yes, I need to do another
Recertify.
course. That was over 2 years ago. So I need to come back and learn more skills, more improved skills, because there are many more areas to learn. So thank you so very much, Mr. Richards and Mr. Webb. Do we have any more questions?
All All right, we are sharing the contact information as we
Yes,
speak. So
please
within
do.
a
Thank you.
minute, you will get that in the chat. All right.
I hope that everyone will be able to see this information. And at this time, we are going to take our last couple of questions. If you have any, this is the time now to ask those questions. Let me see if I find any other questions in the chat. There isn't any at this time. So, Mr. Richards, Mr. Webb, thank you so very much for joining us today. The Transforming Lives Coaching Center continues to support our women, our mothers, our fathers as well, in their journey towards wholeness and wellness. We have a fatherhood webinar series coming up in June. So please stay tuned, and you are always welcome to join in this discussion and share with us. We offer our services, our coaching services, mentoring services, and of course, we have our partners now, eFast, and you can talk to us directly. We can get in touch with them for you, and so you'll be able to access their services. I'm sure that they have a first aid kit on sale. Is that so, Mr. Richards?
Yes, we do sell first aid kits. Yes.
Yes.
Right. We have first aid kits that we distribute here. The first aid kits cost $5,500, and they are well put together with everything that you need. All right. So in summary, I just want to say to you that remember that first aid is important in preserving lives. Remember, at all times, safety comes first, and always seek medical care for any serious injury. Thank you so much. It was a